All right, everybody. Well, we are right at the top of the hour. I'm glad to see more folks jumping on. Thank you all so much for taking time to be here today. I want to go over just a couple of reminders before I hand off our presentation and our time to our guest speaker. Again, this is the October Leadership Education and Development Series. You are all welcome to listen, to learn, to share this. We are recording this session, so we'll make this available for rewatching and sharing on our internal learning management system, which is ECC University. The recording has started, so just a reminder there. And finally, before I hand it over, let me introduce our guest speaker today. We have with us Dr. Linda Brooks Johnson. She is a certified professional life coach. She specializes in coaching breast cancer patients and survivors from their diagnosis throughout their journey. And she herself is a 26-year, two-time breast cancer survivor. So we're so excited to have you with us today to learn from you. I will hand the floor over to you, and thank you for being here with us today.
First of all, Sally, thank you so much. I'm so happy and blessed and honored to be here to share a little bit of my journey on behalf of Breast Cancer Awareness Month. Again, my name is Linda Brooks Johnson. I'm a two-time 26-year breast cancer survivor. I was diagnosed at the age of 39, shortly after giving birth to my last child via C-section. I found the lump about 10 months after going for a mammography. We did a biopsy, and sure enough, it was a malignant tumor. I went on to have surgery, which was a lumpectomy, which is only the surgery just to abstract the tumor from the breast and some of the tissues, but it leaves the breast intact. Upon completing that surgery, I went on for 4 rounds of chemotherapy and 7 weeks of radiation. Thankfully and gratefully, my breast cancer was in the early stages, and it's a very common breast cancer by the name of evasive ductal carcinoma. About 85% of women that get breast cancer is diagnosed with that particular breast cancer. There's been a lot of research and a lot of studies done on that particular one that is causing survivors very longevity after treatment when it's caught early. I went on to have a second diagnosis in 2018. That one, I didn't feel anything, didn't see anything, just thought it was just a normal 3D mammography that I was going for, and boom, breast cancer again. Same identical breast cancer, but this time instead, the other one was non-estrogen receptive, meaning that it was not estrogen driven, but the second one was estrogen receptive, which meant that in the clinical term, I'm a candidate for hormone replacement therapy. I chose not to do that. We went on to do a double mastectomy when they only wanted me to do one, but I felt that it was crucial for me to go ahead and do that so that I could kind of cut the risk of a reoccurrence again. I went on for 1 round of chemotherapy when my oncologist wanted to do 4. I elected just that one because I found out that one of the therapies that they give for keeping the white cells up, which is called Neulasta, I was allergic to it, and I thought I was going to die when I took that medication about 27 hours after chemotherapy. I elected at that time to go back to the doctor to let her know, my oncologist, that I did have a reaction to the medication. She refused not to stop the treatment, but to continue it. I felt at that point that she was not listening to me, that no one could advocate for my body but me. So I elected to choose another oncologist only to find out that I did not need the chemotherapy, that the mastectomies, double mastectomies, was fine. In that interim, I've learned along this journey that we have to advocate for ourselves. You can't just take everybody's word regarding your body or what's going on with you. No one knows you like you do. And you've got to be active and proactive and keep going and going until you feel you've been heard and that your concerns are being addressed. About 1 out of 8 women in the United States will be a victim of breast cancer. Early detection is key, and it is vital that you do your annuals and your monthly self-breast checks, not only for females, but males too can be victims of breast cancer. As long as you've got those tissues, malignancy can be a part of a journey that you don't want. But I advocate every day trying to make sure that we understand our bodies and that we take the necessary steps that we can do in preventing cancer or even breast cancer. Diet, sleep, lack of stress, and trying to be as positive about life as you can is the best formula for keeping off any disease and not just cancer. I am so honored to really be in the seat that I am today, being and can say that I am a 26-year breast cancer survivor, knowing that there's many that have fought the fight and lost it, others that are enduring to this day, and those of us that are now thriving through it. So I can't impress or imply enough that you be vigilant and advocate toward the self-care, not only body-wise, but mentally as well. No other person can know you like you can, and you got to make sure that they listen, and if they don't, you continue to speak until you're heard and that your concerns are addressed. Now, if you've got any questions for me, I'd like to address them.
I'll start off with a question, and I want to encourage everyone on the call to certainly chime in with questions that you have. Something that stood out to me, I know that you are a professional life coach as well. Can you talk to us as a group about what it was through your journey that drew you to being able to help others, or did you have someone who filled that role for you, that you modeled your desire to continue your work in this line of work?
Really, this was just something that after much prayer, that God gave me the insight to go on this journey. My career was with IBM selling AS400 mainstream systems. Never my wildest dream did I ever think that I'd be doing what I'm doing now. But upon going through that journey, I didn't have people rallying around me. I never had a support group, didn't talk to anyone really because no one was there but me and my 2 children. My husband walked out, canceled me off the insurance, and I really had to advocate for myself. My mom was in Atlanta. I was living in Texas at the time, and she couldn't get to me often enough. So I really had to rely on my spiritual walk. And in that, I wanted to really help women concentrate more on living than on cancer. And with that, my journey of life coaching began. I try my best to kind of pivot the role. Cancer is always going to be there, but it's just a part of the journey. It's not the complete journey. The book is still written. That's just a chapter. The more and the more and the vigilant way of getting through this is to concentrate on things that's not associated with it. Because I'm a firm believer, if you stay in it, it'll engulf you. And the one thing you have to do is look at living life. Look at the dreams that you want, the aspirations, the desires. Those are the things now that becomes forefront. Cancer's going to be there. That's a journey. You're going to get through it. but while you're getting through it, live life to the fullest.
Absolutely. Absolutely. Well, and part of the education piece for those of us who maybe don't have the same level of exposure, obviously, that you do, having gone through this and being a survivor and then helping others. What are some ways that we can continue to be involved? You mentioned, self checks, speaking with your doctor, particularly this time of the year being Breast Cancer Awareness Month. What are some ways that are easy, that are beneficial, that are actually impactful, that we can get involved?
Well, you can always look at organizations like the American Cancer Society, the
Mm,
Susan G. Komen Foundation. In every city, state, there are cancer organizations and foundations that do the walks every year, give out seminars, they do rallies. Just get involved and get educated as best you can. And feel free. If you don't know where to turn, you can always contact me. I'll be more than happy to research and find those places for you because I'm really adamant and passionate about making sure we do all we can and to be equipped as best we can to make sure we live a long, healthy life.
absolutely. It looks like we have a question from someone in the audience. Jenny, did you want to come off mute?
Yeah, hi. I just wanted to say thank you to Linda. Um, Nobody ever said to me, make sure you feel heard. This is really a important um, principle for women's health because so many women go to the doctor and are dismissed.
Yeah.
Um, I'm sorry.
No.
I am a 2-year survivor of late stage ovarian cancer and
Mm,
felt very dismissed initially
Mm.
when I was going, to be seen. So just feel like that statement of being an advocate for yourself and making sure that you speak continually until you are heard
Yes.
is so valid.
Yes.
so important.
Jenny,
Do you?
let me say, I'm sorry, Sally.
No, no, no. You go right ahead.
Jenny, let me say to you from my heart, I apologize for those that dismissed you. You are important, you are special, and you need to be heard. If at any time anyone, whether it be your navigators or social worker, anybody that dismisses you, you keep pushing until you find someone that will listen because you matter and you are important.
Yeah, I really appreciate that. I feel like, I personally am at a place now where I've got such a quality team of people that do listen, and
Right.
I have felt heard. But just that initial part of the journey, hearing you say that, it was just triggering because there are so many women that just are not heard, and then they just,
Yep.
cower to the shadows. And it's important, even if, you think it's nothing, it's important to have someone address that and validate, what you feel.
Well, I'm glad that you were able to find adequate um, resources and people that did take you seriously. I can't tell you enough how I just got back from Washington fighting for new policies for the breast cancer and cervical cancer health policies to be implemented during the session coming up with Congress. I can't tell you the fight that I'm trying to fight to make sure that we all are heard, that we all are given the platform to advocate for ourselves and for others to listen and understand what we go through, because no one knows what you're going through in this journey but you. And we deserve to be heard.
Thank you so much, Jenny, for speaking up and sharing
Yeah,
your
no, of
perspective
course,
and your story.
absolutely. Yeah, sorry for the emotion, but it's
No,
just
Oh,
so important for women to be
no,
heard, and that just was a really powerful statement, and I appreciate you, Linda. Thank you so much.
you're more than welcome. That's what we're here for. These sessions are ones that are phenomenal. Um, so many times you get women and men that go through breast cancer that want to hide, that don't want anyone to know what they're going through. But I found that when we start speaking and expressing our emotional side of what we've gone through, we touch the lives and hearts of many people. And that's what's crucial now, not to be put on the back burner. And Jenny, many people that have gone through what you've gone through have taken the initiative to never reach out again, to give up. And that's what I'm fighting for, to make sure that doesn't happen, because we've come a long way, yet we still got a long way to go. But we have to make sure that people are heard. I don't care if it's ovarian, cervical, breast, colon, lung, whatever cancer or illness it is. We have a right to be heard, and we have a right to be addressed in the proper way.
absolutely. I wanted to ask a question that actually made me think of too, because there are so many stories that we don't hear. And of course, we never want to pry and we never want to make someone feel as though they have to share their story. But there may be a lot of us on this call, especially, that are support people for those in our lives or family members or friends who have gone through this. Do you have advice for that role that we may take on, whether it's now, in the past, maybe in the future? Advice on how we can best support those that we love that may be going through this.
I think the best thing with me that I would give, because I was a caregiver for my mom for 15 years after a massive stroke. And caregiving, I don't care what the illness is still a very daunting and very overwhelming role. I think the first thing that I would say is make sure that you take care of you. You cannot take care of someone else if you're not whole. Your mental health is crucial, because in times it will be where things are thrown at you where you take it personally that you shouldn't. If it means getting a coach, getting a counselor, do that. Find someone that you can release with and that will be non judgmental and that will help you along the journey. Many times I found that when you're going through a journey, if there's someone that's gone through that journey, that's really a good support network because they understand. Oftentimes we get with people that don't understand, that have never been through what we've gone through, and we reach out, and a lot of what they say can be more from the flesh than from experience. So I would say make sure you take care of your mental health. Put you first. Make sure you're whole and complete before you can be with anyone else. That would be the main thing. The other thing would be make sure you have an outlet, that you're getting out and about, experiencing life, the daily things of life. Don't lock up. Don't get in a place to where you isolate, because once you isolate, depression can hit really quick and it comes on really fast. That's what you don't want. You still have to put things in perspective and make sure you prioritize your day. You can't give all of yourself to anybody. You've got to leave some for you.
Yeah, sometimes that gets really hard, but it's such a good reminder to not get so singularly focused, kind of tunnel vision.
Mm-hmm.
Just speaking personally, my best friend unfortunately passed away in
Mm-hmm.
2019 from ovarian cancer, and I was her primary caregiver at the time, just because her family lives out of state. And it was, you get very much tunnel vision. It's,
Yep.
I want to do everything. This is my whole world. I want to help you. And it's hard to remember to take that time for yourself. So that's a
Yep.
good reminder.
And always reach out for help. It's not, there's somebody somewhere that can help. I mean, there's agencies, especially with the cancer foundations, they have advocates in place that will come and sit. Let someone relieve you for an hour or two. Get away from it. You can't just be entailed in caregiving 24 hours a day. It'll just eat you up if you do.
Absolutely. Absolutely. Well, I have a couple of other questions for you, but I wanted to stop talking for a moment and see if anybody else in the
Okay.
group, anybody else have questions or comments that you wanted to share?
Come on, guys. I know you got some.
I have a comment, well, more of a story, and mine was centered around my dad. He had lung cancer.
Mm.
When it was found, it was already too late. He was diagnosed with stage 4, and he was given even stage before he were cleared. In so much pain. I remember hearing that cancer doesn't hurt until it's in its final stage. I don't know how true that is, but he was in so much pain, and he was moaning and groaning so loudly that the neighbors called the cops on us,
Oh,
and they thought that we were abusing our dad. And they came, and we had to prove that we were hurting
wow.
him. So
Oh,
there are times when these things happen, you really need an outlet. You need,
yes,
you know,
definitely.
someone or something to as a as an escape.
Mhm.
Because sometimes when people don't know and then you're misjudged,
Right.
so yeah, it was hard dealing with that and then having to, prove to these police officers who showed up saying,
Wow.
hey, we got a complaint that you guys are abusing your parents, and
Mm.
you know
Did they by any chance offer you guys hospice care?
no, he was in the hospital for one, and then he elected to come home. He wanted to be with his family in his
Well, they
final
have a
days.
hospice. They have a hospice care that would have been the ideal thing for him to have hospice care at home. That's what
Ah,
it's there for, and it would have alleviated any of the stigma that you were abusing him because you would
yeah,
have had nurses coming in to help you care for him.
yeah, we didn't have that.
Yeah, that's something that oftentimes people think that you've got to put them in a facility for hospice. No, I had hospice for my mom at home, and it's just a better way to allow them to transition in the comfort of their home.
Yeah, yeah, we didn't have that.
Yeah, well,
I didn't know
if
about that either.
yeah, well, if you ever encounter anyone that goes through that, that's a way to keep that stigma of abuse away because you have clinical people that are right there that's guiding and navigating you through the process and also would have helped aid him in the pain management.
Yeah. Anyway, that's my story.
Well,
I
thank you for
still
sharing.
get
And
emotional.
yeah, like I said, if you ever maybe know someone or someone needs that, always remember hospice care is not just a facility. You can have hospice care at home.
Yes, thank you.
You're welcome.
And we had Esmeralda, you have your hand raised?
Yes. Can you hear me?
Uh-huh.
I so I have a question, and it's probably more of a little bit of advice. I have a few people, elementary friends that have cancer, for about over fighting cancer. They're terminal, but and I have family members right now, and I'm a very big helper when it comes to this kinds of scenarios. I want to be there and provide the support, but I get caught up asking too many times, like, how are you doing? And I know they probably don't want to hear it. So what's the best way to find out, like, how can I help without asking them, what did your doctor say? Or I know sometimes they just don't want to be asked. And maybe that's why sometimes they avoid being surrounded by family, because they are getting asked constantly the same question. And so, what can I do to make sure that they're okay, and provide them the support that they need? Like, I offer to take them to doctors, or just take them out to lunch or dinner, or provide anything that they might need that they can't get. One of them is 10 years younger than I am, and it makes me, think, wow, these could be almost the age of my children. So I always push my kids to go get their physicals and everything that they need to. I have 4 girls, but knowing that one of my cousins, who's much younger than I, is on her second bout with an extreme form of aggressive breast cancer, and I feel like she shies away because I feel like I catch myself asking too many times.
Well, and your observance is true. The one thing that a person battling anything wants to constantly hear is, how you doing? Can I do this? Can I do that? I think the best thing to do is just love on them. Don't ask, just do. I can't tell you how just letting them open up to you is the best medication you can give to them. If that time comes and you're around and they need something, if you've, initially said, hey, I'm here. If you need this, if you need that, I'm just a phone call away. I'm just a shout away. Whatever that is, do that and then give them their space. Let them come to you when they need something. Unless you see them in a situation where they need some help and you're there, then by all means help. But if it's not that kind of scenario, just love them from a distance, but let them reach out to you when they feel comfortable.
Thank you for that. Thank
You're
you.
welcome. Come on, guys.
If I can touch on that, I have been dealing a lot with my mother. She's a breast cancer survivor, actually 2 times, and
Okay.
she's had other health issues. And she's a very independent woman. So I would say, for someone like that, the best question to ask them and to check in with them is, what do you need? What would you
Exactly.
like?
Exactly.
Um, if sometimes I will just, do. But she's always worried about inconveniencing me, taking up too much of my time. So, being there, but also asking that question, what do you need? I
Right.
find is good.
Right. And you're right. It is. I think what we have to do is try to make them more engaged in life rather than making them think about what they're going through. Anytime you can get a person off of whatever they're going through onto something different that's positive is a very remedying effect for them. Many times people will ask the wrong questions and not think and not intentionally do it, but what the deliver of it, the person that is receiving it takes it totally different than you delivered it. And that's what we got to be careful about. And that's it's a really hard road to travel because often we haven't traveled that road before. We haven't traveled the caregiver's road. We haven't gone through what that person's gone through. So it's a learning curve for us as well.
I think, Margie, I saw your hand raised.
Yes, thank you, Sally. Yeah, I just had a couple comments for people who, if you know that they're, having medical problems or just really anything, instead of saying, hey, how are you when you greet them, is saying things like, great to see you, great spending some time with you, and just kind of staying away from the how are you words and letting them kind of talk about that when they're ready. So that was just one thought I had. And then I had a question for you, and that's just really kind of what your thoughts are around genetic testing.
Very good. I'm glad you brought that up. I think in my situation, being a 26-year survivor, they recommend that I go and get genetic testing every 3 to 5 years, just to make sure that new testings that's coming about catch anything that's come out new in the diagnostic area. I did get genetically tested at my last bout in 2018. Found at that time that I didn't carry the bracket gene. There was nothing determined that it was hereditary. I had no diagnosis prior to me in the family with breast cancer. So it was a puzzle as to how I came about getting it. Now, since I've been diagnosed, I've got family members that are breaking out just about every so often with a diagnosis of breast cancer. I think a lot of it is environmental. I think a lot of it is food. But genetic testing, I really believe that it is one way that you can know some things about your lineage on what's there in terms of mutations, in terms of things being there. It may not be breast cancer, but it may be a risk or a watch for lung cancer or some other type cancer. Because when you do the genetic testing, it goes through a series of things that it tests you for. So I think it's crucial, especially in today's living.
Thank you. I appreciate that.
Mm-hmm.
If I can just hop on that, obviously I'm by no means an expert in this, but Margie, to your question about genetic testing, when my friend Sarah was going through genetic testing, they found that there was absolutely no trace of any sort of cancer gene in her family, but they explained it very well in that the testing was meant to find and isolate specific genes that certain types of chemotherapy reacted better with. So having that testing let them know if you would be more susceptible to that kind of therapy, which I thought was really interesting. I thought it was more of, let's just chase or trace the lineage. But as Linda brought out too, it's more about the whole person, kind of finding out the entire effects, not just who else in the family might be prone or have a genetic marker for that kind of cancer. It's also how to proceed.
It sounds like what she had was more genetic testing in a sense, but more it was conducive to trying to find out what cancer would treat that particular cancer.
Yes.
There are so many different types of genetic testing that doctors can steer you toward or even recommend. The one that I did was the testing that just showed me if I carried a gene for any type of the cancers that's known. I didn't take one to determine what type of treatment. And that was something I'm glad you brought up. That's something that I really think should be done because it's not a one dose stop. And the way it is now, certain types of cancer, breast cancers, are automatic protocol. It doesn't go about seeing if it's best for you or if it's not good for you. If you've got this particular breast cancer, this is the protocol. And we know that everybody does not react to the same treatment or medication. I think we've got to fine tune it to where even though it's given, it's critical to find out what treatment is better for that particular person rather than that particular cancer. Does that make sense?
Yeah, absolutely.
Yep.
Okay. Because oftentimes we're finding out that the treatment is what's killing and not and not the cancer. The treatment sometimes can be very aggressive and sometimes too aggressive, that it winds up doing more damage than it does good.
Any other questions or comments from the team? Mike, yes, I see your hand raised.
Yeah, just twofold. First, thank you for being part of this and giving us your story. Second, as a father of two young daughters, they're in their early 20s. They're athletic and run marathons and things. Um, I have a history of breast cancer on my side of the family, not on my wife's side. How can I better impose on my daughters the need to check and the need to do testing or to better prepare themselves?
How old are they?
24 and 25.
Okay, so they're at the age now where they really should be doing self-breast exam monthly. And those checks should be done, I would say, anywhere from 5 to 7 days after the menstrual cycle. Checking the breast up under the armpit, making sure they check the neck area all around. Now, I know that baseline right now that they have where they don't do screening until age 40. If that had been in place at the time that I was diagnosed, I probably wouldn't be here. But the one thing that you can do is when they go in for their annuals, make sure the doctor does an annual breast exam. That is crucial. If they miss something, you've got another set of hands that uh, knows what to look for, and it could be a different scenario altogether. So I would say the monthly breast self exam and then the annual breast exam when they go in. And those two are crucial. They work together. Nobody knows their bodies like they do. And getting that done. The other thing I would suggest for you to do too is find out what breast cancer organization is in your area and try to facilitate with them getting information to give to them on how to successfully check, just get information on that. The the youngest breast cancer survivor right now is 9 years old, and she had to have um, a single mastectomy at the age of 9. Well, she's 10 now, but that was at the age of 9. Today, more and more women are being diagnosed prior to age 30. So it's crucial that young women get more involved with their body and checking, because 9 times out of 10, when they find out, we're talking about stage 3 and stage 4 cancer, to where now it's metastasized and you're a metastatic breast cancer patient, which when you get to that stage, you're on medication for the rest of your life.
Oh, wow. Okay. Well, thank you. I appreciate it.
You're more than, and by the way, you too, make sure you do the self-breast exams, because if it's on your side, that makes you prominent as well.
Okay. Thank you.
You're welcome.
And Linda, correct me if I'm wrong. One thing that my doctor told me about those self exams is stressing the importance of doing it month over month, because
Right.
it's not just lumps and bumps, it's changes in those lumps and bumps.
Exactly. Exactly. Especially if you see the nipple get introverted, or if you see it swelling or pus coming out of the nipple, or a color change, a rash. And see, oftentimes people think breast cancer is a lump. It's not. You can have a rash that looks like detergent, like something in the clothes you're allergic to. No, it can be breast cancer. It can be an inflammation type of inflammatory breast cancer, meaning that you don't have a lump. It's not anything that you would see. It's just a rash. And that undetected can be, it can be devastating.
Yeah, definitely.
So it's a lot of things to look out for. Any redness in the chest, any pain. The rumor was when I was first diagnosed that cancer doesn't hurt. That's a lie. That tumor was awfully painful. And what was really different for me was I had at age 19 two breast surgeries on my left breast for fibrocystic tumors. Well, the cancer was on my right side, and it felt just like and acted like the fibroid tumors did. Had I not looked at it as, okay, let me go get this checked out, I never would have known it was actually cancer. So don't self diagnose yourself, because you don't have all the facts in hand to make a strong diagnosis, and don't put that on yourself. Sometimes we think it's nothing, and it may not be, but don't leave chance to chance that it could be something greater than what it is.
Yeah. Definitely don't rely on Google or MD,
Oh no, oh
WebMD.
no, please don't. Please don't. And a lot of people do that, believe it or not.
Yeah, yeah. Unfortunately, that is not surprising.
Yeah.
I want to take the opportunity to remind everybody on the call, and certainly we've got other HR team members and members of the wellness team who can speak to this as well. But I really want to encourage those of you who have ECC's insurance to utilize that preventative care,
Yes.
because preventative care is covered at 100%. So
Oh,
getting
wow.
on top of that is so important, because early
Yes.
detection is
It's
the
key.
key. Yeah,
Oh, it is. It is. Makes all the difference in the world.
absolutely. Absolutely.
And I tell
Um,
you, I'm sorry, Stella.
oh, no, no, you go right ahead.
I think when you look at chemotherapy and radiation and you can prevent that, I think that would make me run to the doctor, because I can tell you chemotherapy is not, oh my God. I wouldn't wish it on my worst enemy. And radiation is not a walk in the park as well.
Those are definitely not things you want to have to rely on.
Mm-mm.
So it's Kate. I just want to remind everybody, because I know Cigna has sent out the email, and I believe Tiffany also did, that Know Your Lemons is an app that we get through Cigna, that is a global charity that educates about breast cancer and breast health in a way that's like, it says refreshing, and it just is like kind of just putting it in a more nonchalant way so that we're seeing it and not going, oh my gosh, this is scary, I'm not going to think about it. But it talks about like the symptoms of breast cancer, how to do self exams. It can set up monthly reminders for you, and it talks about risk factors and all of that. And again, this is through our insurance, so it's nothing extra that you have to pay.
Great. That's absolutely wonderful.
Thanks, Kate.
Can you repeat that again or send it on chat?
I
The
absolutely send it out in chat, and I will email blast it out to the company again.
Thank you.
If anybody knows of anyone that is not insured, that needs a mammography or any resources, please reach out to me and I'll be more than happy to give you the resource information that can aid them in getting the needed mammographies or anything else that they need. Just because they're not insured doesn't mean there's no help.
Oh, amazing. Thank you for offering that. And for everybody here, I will do the same. I'll send that in the chat and out to the larger audience, just so that we've got Linda's contact information in case you have additional questions.
Yep, I'll be here to help.
Thank you so much. Anybody else have questions or comments while we have the team together? All right. Well, I want to thank you so much, Linda, for taking time to be here with us today, for educating us, for sharing your story, and for really, hopefully the end result is inspiring all of us to take that control over our own health and certainly be there for those in our life who may be going through it similarly. So thank you for providing those resources and that support.
No problem. Just remember, you're not alone.
Absolutely. Thank you all very much for being here and part of this discussion. Thank you to those of you who shared your stories and the stories of your loved ones. We appreciate you all and hope that you have a wonderful day and a wonderful remainder of your October.
You too. Thanks, guys.
Thank you so much.
All righty. Enjoy your
Thanks,
rest of your
all.
day.
Times in a day.
Bye.
Okay.
Thank you
Thank
so
you.
much. I appreciate it.
Thanks.
Oh, you're
Thank
all
you.
welcome.
Thank you.
You're welcome. Bye-bye.
Bye-bye.